about a patient case of mine. I'm a speech pathologist and I'm a professor as well. And I know that not every country has a division for speech pathology. So I'll talk about a little bit about what we do as speech pathologists. It's very broad field. It covers everything from infants in the neonatal intensive care units that have feeding and swallowing disorders. We help with feeding and training those infants, and then speech disorders and cognitive disorders. We see patients post-stroke, post-traumatic brain injury, helping them rehabilitate, along with our physical therapist and occupational therapist. And we see patients at the end of life with severe dementia. We help maintain as much communication as possible so they have dignity. And I would say that's the main thing that we get to do in our careers, is give people dignity. So I'm very blessed to be able to do that. For this particular patient, very interesting case where they wanted to use a service animal they have Tourette syndrome, and most of it includes vocal tics. They have some motor tics, those becoming quite a problem, and they talked to their neurologist about it and psychologist, and she wanted to come off of some of her medications. She also has pretty severe attention deficit disorder, and some of the medications were interacting with each other where they were not as effective. So we're trying to find some non-pharmacologic solutions to treating her vocal tics. And she actually came to me about this, about having a service animal. She's like, can we train a service animal to respond to my tics? And after reviewing my scope of practice and the literature on it, I was like, I think we can. I think this is going to be okay. Let's try it out and see if it's a good solution, along with some of the medications you're taking and stuff like that. There's never a one size fits all solution. You're usually going to have to use multiple things. So the psychologist she was working with would not sign off on this. So that's why she found me. She was like, I've looked at your scope of practice as a speech pathologist, and I think that you can work with me on this. So that's where we started off. She was about 21 when we started working and training the service animal. So just a little introduction here about Tourette syndrome. It is a neurological disease, and mostly characterized by motor tics and vocal tics. A lot of patients do have comorbidity of attention deficit disorders, obsessive compulsive disorders. And this particular patient does have pretty severe attention deficit disorder. So why was I working with this patient, and why would we use a service animal for this? Quality of life. So this patient she's a teacher at elementary school, and some of these things started interrupting her whenever she would have vocal tics, motor tics, especially vocally. She's a music teacher, so that came into play quite a lot. Most of her vocal tics sound just kind of like a hum or a tweet, kind of like a bird. And as she gets more anxious, if she's in a situation where she's in crowds, or if she's standing up in front of people, it tends to escalate. So we were trying to reduce that escalation. So overview, what we looked at evidence-based practice in healthcare, we know that kind of drives the field. So took the client's perspective that her preference was to try to train a service animal. The clinical expertise I had, knowing the neurological system, your speech pathologists are well versed in that. And then the evidence in the literature, have we used service animals with other neurological disorders? Most of the literature is on things like Parkinson's disease, which there is a bit of literature on some of the Tourette's aspects happening or originating in the same general area around the basal ganglia, and then some of the dopaminergic effect of that. So that's what we kind of went on with the literature. Okay, our method with this. So she would have people that would mention, her vocal tics, and that made her very self-aware of that. And she did not want that in her life. She has several drug regimens she was on. This is difficult too at a teenage or young adult stage because of the changing hormones. So it's hard to manage medication in these stages. And then some of the ADHD medicine she was on was interacting with her Tourette's medicine. And so we were wanting to reduce at least one of those. So maybe we had less drug interaction going on. We do know in the literature, there's a strong push for relaxation therapy with Tourette syndrome. And using a service animal is a type of relaxation therapy because we're going into those sensory pathways and calming down using the parasympathetic nervous system. So that was the basis of evidence for that. Otherwise, the main treatment that neurologists recommend is deep brain stimulation, which we do a lot of that for Parkinson's disease as well. However, this patient did not want something so invasive. She wanted something very minimally invasive. She didn't want to go into surgery, have the electrodes placed or anything like that. So we tried to meet that, even though DBS has very good outcomes in our patients with Tourette's. She did not prefer that. So that's why we went with the relaxation therapy technique. Right, so we do know in the literature that our presence of service dogs, animals, they're proven to reduce heart rate, blood pressure, respiratory rate, decreasing our cortisol levels, and regulating homeostasis, again, through the parasympathetic nervous system. So good evidence for using this service dog. This is a very holistic approach that we're trying to use. We're not trying to negate medication. This patient is still on medication. We're just trying to reduce interactions of the medication. And then also, we know that our symptoms of Tourette syndrome may be exacerbated due to those striatal dopaminergic release pathways that cause dyskinesia. This particular patient, most of her dyskinesia is in the evening, at night. So she was, when she sleeps, she was having almost a restless leg syndrome. So just kicking at night and not being able to sleep. So the dog that we started training actually lays across her legs at night, and that has totally reduced it. She does not wake up in the middle of the night anymore as the dog lays across her legs. So that was the first thing that we noticed, and we're like, okay, I think this may work. And then what we started doing from there was training the dog to respond to the tics. Now, a service animal, the regulation is that they are trained 120 hours in a specific task. So this animal is trained to recognize when there is a motor or vocal tic and then respond with a pause on approach. So whenever the patient is having a vocal tic, the dog will kind of cock its head and noticing that. We train that dog by saying every time she was having a vocal tic, the patient had to recognize it and say, do you hear that? Do you hear that? And through several months, the dog would recognize that. And then the patient would say, okay, I'm in a tic, pause on. And so the dog, it's a rather large dog too. So it would, there's a lot of sensory effects with a rather large dog. And it would put her, the pause on her shoulders. So the patient would sit down, dog would come over, put the paws on her shoulders, and it would almost immediately reduce the vocal tic. And so that was quite amazing seeing that. I was not expecting it to be immediately gone like that once the dog put its paws on, having that sensory effect. So as the dog has been doing that, it automatically now recognizes the tic, comes over to the patient to kind of nudge the patient that the dog needs to put its paws on. And that has significantly helped the quality of life for this patient. She functions well in her job now. Really doesn't tell me that she has any issues. So we're still getting to the point where of feeling comfortable taking the dog places. Sometimes she's like, I don't know. There's just a little anxiety ridden there of, can I take my dog here? And so I'm trying to counsel the patient to get her comfortable with, yes, it is a service animal. You can take this dog with you wherever you are, if you're in a restaurant, et cetera, so forth. So the patient is still quite young. And so I see the anxiety with that, but hopefully over the next few months, she'll feel more comfortable with taking the dog with her in multiple places. So conclusion here, clear benefits to using this treatment. It is, it's different. There's not any literature specifically for Tourette syndrome. There are for those other neurological diseases. And we were also looking at, again, the neurological diseases that have similar treatment approaches to what is the primary treatment for this, with Parkinson's being deep brain stimulation. And then also this, so that's kind of what we were comparing and attesting it to. So this pause on approach, again, leading that homeostatic balance with gentle sensory stimulation, which is, just a general approach to patients who are overstimulated and whatever that may be. In speech pathology, we work a lot with patients with sensory disorders, whether that be autism or other intellectual disabilities or neurological disabilities. So I was pretty comfortable with doing any kind of sensory approach, and it never occurred to me that Tourette syndrome would be one of those needs until this patient brought it up, and very much so we see that it is. So I've actually this is published too in the British Journal of Neuroscience Nursing. It's in the October-November issue, the most recent issue, if you want to read the full article. And then this is, I've also done a poster at the Tourette Association of America. So they were very interested in this as well, as most of the research that we see with Tourette syndrome comes from a medication standpoint, as we're doing different formulas for drugs. Oh, what if we add this? What if we add this? How will it affect the dopaminergic pathway? So there's not as much research on the non-pharmacologic side, but I think this definitely adds to it as an option for patients. That's the main thing, is that we're giving patients options that work for them. And with relaxation therapy, most of those patients are going to counselors. The reality is that's not always available in communities, especially if you're in rural communities. Also with, insurance funding and stuff like that, that's just not a option for all of our patients. So we want something that they have all the time. And yes, training an animal is it's work. I mean, you put in a lot of work to it, but it's a lot more convenient than having to try to drive or get transportation to going to appointments weekly with a psychologist. So this was very helpful for the patient. Hopefully we'll see more patients that try this out if they are having a lot of drug interactions. So what's next? We definitely need more trials on individuals who are wanting to try this out. A specific training protocol for the animals, because we pretty much developed our own based on that 120 hours that is from the American Service Animal Association, but there's not like a specificity to it. It's just like, hey, you need to train it in a specific task for these 120 hours. So we would like to develop a very specific protocol for Tourette syndrome. And then I don't have access to neuroimaging, so we don't have neuroimaging to see what is happening in the brain as this occurs, as the dog puts its paws on. So we don't have access to that. So hopefully somebody will take that up in the future and continue this research. And here are references in the literature to all of those recommendations, from everything from the relaxation therapy to what neurological diseases are already using these techniques. So please, if you have any questions, feel free to contact me. Also, if you would like to explore that a little further, you absolutely can look it up in the British Journal of Neuroscience Nursing. Thank you very much.